Great attendance. Wonderful. All right, we're one past the hour. We'll get started. Welcome, everyone. My name is Nathan Pope. I am your moderator this evening for this webinar related to community-based pharmacy residency programs. Build a strong foundation for your career. So I am an employee of ASHP. However, I've been very involved in APHA and I'm a fellow of APHA as well. This webinar is presented jointly by APHA and ASHP because accredited residency programs are accredited by ASHP in partnership with APHA. And so we love to have the joint partnership between these two wonderful organizations to help advance residency training. So we're going to dive right into it so that we can make sure we get to the most exciting part, to the resident panel or recent resident panel as well. So we have our objectives that we're going to cover today. Our goal really is just to make sure you become more aware of what community-based pharmacy residencies are, make sure to differentiate between different sites and maybe recognize some opportunities available to you as students or just those interested in community-based residency. So here is our group of ASHP and APHA representatives. I just realized my title slide says ASHP and ASHP. It's and APHA representatives. So as we said, my name is Nathan Pope. So I'm an accreditation services associate. What that means is that I go out and I survey residency programs to accredit them essentially, or give my recommendation, and they're accredited officially by the Commission on Credentialing of ASHP. So I've been doing that for 2 years now, full time. But prior to that, I was a faculty member and residency program director at the University of Texas at Austin in Austin, Texas. So if there's anyone from Texas, hook 'em. And but I live now and come to you from Chicago, Illinois, where I relocated when taking this position. So just a little bit about me, but I'll move on. So I'll introduce Amy Hyduck Cardillo is with ASHP as well, and I'll let Amy introduce herself.
Welcome, everyone. My name is Amy Hyduck Cardillo. I am the Director of Operations for Accreditation Services with ASHP. I have been with ASHP since 2018. I was previously a lead surveyor, just like Nathan is. I work remotely from Northern Michigan. My background prior to joining ASHP, I was in health system pharmacy and started a PGY1 pharmacy residency program and served as the RPD of that program and was the system pharmacy director there as well. So I have the honor in my current role of serving as the liaison from ASHP's accreditation services to APHA. And thank you for joining tonight.
Thank you, Amy. And next we'll skip down to Bridget Groves from APHA, and I'll let her introduce herself and mention Kelly.
Wonderful. Thanks, Nathan. Well, good day to everyone. Thank you so much for joining us. My name is Bridget Groves, and I am the Vice President of Professional Affairs at the American Pharmacists Association. One of the pieces of my role is to serve as our staff liaison to ASHP for the accreditation of the PGY1 community-based residency programs. So we've had a long-standing partnership with ASHP to accredit the community-based programs a little over 25 years now, and really appreciate the opportunity to collaborate together and are really looking forward to connecting with you all this evening and or day, whatever time it might be where you are, on the opportunities that are surrounding the community-based residency programs. I completed a 2-year community administration and leadership residency just a few years ago. More than just a few years ago, but I'd like to think it's not that long ago. And then I've also served as a residency program director for the 2-year community-based program, and then a preceptor for a different community-based program, as well as a guest surveyor, and now kind of overseeing our program relationship and partnership. And so community residency training is very near and dear to my heart, and I have found extreme value in it for my own career, but also have seen how others have certainly benefited both from community leadership, management, patient care, and just a variety of other areas. So really excited that you've taken the chance to join us today to learn a little bit more. Not joining us today, but certainly A very important person in community-based residency training is Kelly Good. Dr. Good is a professor at VCU, Virginia Commonwealth University, and she also oversees their community-based residency program and has done so for many years as the RPD there. And as such, has had the opportunity to serve as APHA's representative on the ASHP Commission on Credentialing, and helps to really bring the community-based residency voice to that table. Is a staunch advocate for her residents and the residents in community-based programs, and we're very grateful for all that she does to help grow and promote community-based residency programs, in particular through her own program, but then also with her work on the commission.
Great. Thank you, Bridget. She is here with us in spirit. And then, of course, what you all want to hear later on is we have resident perspectives for you, and they're gonna save their introductions for later. But I wanted to tease you that we have two residents, one who's actually in her residency training right now, and then another who is just finished residency. So great representation and from different parts of the country. And this webinar is focused on specialty pharmacy in a health system and HMO health system. So the more health system side of things. And then I have a slide at the end that I'll tease that in October. Well, if you got the link to sign up for this one, you probably saw there's an October one as well, and that is going to be focused on independent pharmacy and community-based chain. So different settings, so that we can hope to create awareness that community-based residencies occur in a lot of different places. All right, so without further ado, let's continue on. I'm going to just give a little background about what community-based residency is in case you're completely unaware of it. I'm going to have our guests turn their cameras off, and we'll go into that. They'll join us back again after the intro. Um, Before I get started, I'll reiterate what Bridget put in the chat, that welcome. And if you are going to ask questions, feel free to ask them. You have the multiple opportunities. You can ask them verbally at the end when we get to the panel session of the residents, and really it can be of the residents or anyone that just introduced themselves. Or if you want to just put it in typing, we prefer if you could put it into the Q&A versus the chat. So if you're not as familiar with Zoom, in the panel where it has your mute button and video button, you might have to go to the more with the three dots, and in there is where I find my Q&A. So you can enter there, and then Bridget is going to monitor that and kind of collate and share those with me during the Q&A session. Excuse me. But in the chat now, since we are in Zoom and we can make this a little interactive, before I go in, let me know if everyone would let me know where you are coming to us from. If you want to put city, state, or area of the country, you don't have to be specific to, for privacy reasons, but do we have anyone from California or Texas or New Jersey or Illinois? Where are you all coming to us from? Great. All over. Thank you. Allowed me to get my water there. We have New York, we have California, we have the country represented. This is fantastic. Thank you for sharing that. That's good to know that our marketing spread across the country there. So wonderful to hear. Thank you. Please tell your friends, fellow students, anyone interested about the October webinar, and so we can increase our numbers there too. All right. So thank you for sharing that. Great to see you all, and thanks for joining. And we'll chat with you more when we get to the panel discussion. So what is a residency? This may seem rudimentary, but some of you may not even really know what is involved in this. So it is a voluntary 1 or 2 year postgraduate training program. So that's key, voluntary for pharmacy. You don't have to do it, but there can be a lot of benefits for doing it, and we're going to get into that. You could experience working with pharmacists and other healthcare professionals, but in a more specific way. And again, I'll go into why you'll get different type of experience working with other practitioners in a residency versus going straight out into practice, where you'd still work with them, but maybe in different ways. It is definitely direct patient care focused. You may hear of fellowships. Fellowships often, they don't have a set standard accreditation process, so they're often not focused in patient care, but there could be patient care involved in them. But just so you know, if you choose residency as a route over fellowship or other ways, it is focused on direct patient care, and our accreditation standards do require that a residency program is a majority of direct patient care, so you get that experience. But through residency, you also get mentoring. You have preceptors, you interact with others, maybe your residency program director. Hopefully, will become a lifelong mentor to you, not just even in the residency program. I'm still in touch with many of my residents that I went through. Not everyone, we don't always like connect, but a lot of residents we're still in touch with. And honestly, go back and forth. I consider some of them almost mentors too. Um, Leadership development is something that residencies will focus in on their specific objectives related to that. So right off the bat out of school, you can develop your leadership skills and potentially move into leadership either right after residency or shortly after another position. And then research experience. I hear a lot of residents pick a residency to do that so they can get more experience in analyzing data. Maybe you got some experience in school, but residency, you will do a research project. And so you'll get that experience there. So a lot of different opportunities to develop your direct patient care skills, but also leadership, research, other projects, and so on. So a lot of cool things that you can do in residency. So there are multiple different kinds of residency programs. So I wanted to make sure we covered that. So we're just covering community-based residency, but there's also the PGY1 pharmacy residency. Those can be in many settings as well, just like community-based. You traditionally find them in health systems or hospitals, but they can also be in ambulatory clinics. It's kind of wide open on the type of setting that a PGY1 pharmacy residency could be in. So if you're researching programs, it would be important to know and ask questions and find out what type of setting. And also hospitals are different. Some hospitals focus in really acute critical care. Others might be more community focused, meaning smaller, rural, serving the community there versus like a large medical or academic medical center in a large city. So a lot of different settings for them. Then there's managed care in managed care companies. So those traditionally there's patient care focus in them, but not as direct as community or traditional pharmacy residency. So you can look into those and they're accredited in partnership with AMCP. And then there are combined PGY1 and PGY2 residency programs where traditionally, or they may be a leadership focused. So we accredit ones that are 2 years. You get the benefit of completing a first year and a second year, and you get the certificate for both years, and traditionally a lot of leadership and administration focus with those. They're both in community settings as well as health system settings. So those are the ones that start with a PGY1 program. There are a lot of PGY2 specialty, but we're not going to go into that. If you have interest in looking into that, go to the residency resources website that will have a QR code to at the end of this session to look into that. But we didn't want to get ahead of ourselves. We want to focus on the first year right after school. So community-based residency specifically is usually right after you finish school, but you could be out in the world and practicing for a few years or more and come back and do a residency. It's really focused on creating practitioners that provide patient care in the communities where they live and work. So traditionally, it would be community pharmacies. You've got everyone from independent pharmacies to chain pharmacies, grocery chain. You've also got ambulatory, and I think I've got more examples on the next slide, so I won't get ahead of myself there. But by doing a community-based residency, you're going to go in to get experience with diverse patient care, the practice management, and leadership and education even. So if you really enjoy teaching others, maybe you got some experience during school, you may have a passion for helping others learn, you get experience with that in residency as well, as precepting is a requirement, as well as presentations and other forms of education. You'll get prepared to be an expert in the patient care that you provide after your residency, though patient care is always changing, but you'll learn the skills on what it takes to make sure you stay up to date in patient care as you go through your career. You'll be eligible to seek board certification. If you just saw in a lot of the credentials in my colleagues that we introduced earlier had board certifications. I previously was board certified in ambulatory care, but let that go now that I'm not in a direct patient care role. So I think there's a lot of value to having that credential. And then, of course, it makes you eligible to do a PGY2. That's a accredited residency as well. It's just 1 year traditionally, so 52 weeks traditionally start July 1st, but some residency training will start maybe a week before that or just around the July 1st timeframe through the following end of June. We already talked about how it's really patient care focused. You'll get really good experiences getting mentored by a lot of different community-based pharmacist practitioners. I think that's one of the greatest benefits of doing a residency. It's one of the reasons I chose to do a residency, was I wanted to get mentored by others in the same area that I was interested in. Of course, I was exposed to it in school, but you really get that concentrated experience and get to know everyone in your residency really well because you're in the trenches together. So that can really be helpful during the program as well as after the program. You'll focus on your local community that you're in. You provide them health and wellness services, probably medication education, and other community and volunteerism. So you're not just working in an organization, you really are getting to know the community that you're amongst. And the community-based residencies really do a good job of that. And then lastly, just as a reminder, this is a partnership between ASHP and APHA. We are step and step. That's why we've got representatives from both. Like I said, I'm technically now an ASHP employee. I never thought I would be because my organization home where I volunteered through the years was always APHA. And then really saw this partnership and saw the benefit of getting involved in residency training with community-based residency. And that's how I ended up where I am. You never know where your career is going to take you. But I think it started with residency. So I really feel like residency benefited me and it could benefit you too. So here's the settings that community-based residency can be a part of, all different types of settings. So sometimes it could be confusing and overwhelming as you're looking into it. So I understand that and recognize that, but also it could be really wonderful that you have all these choices for settings that you could do your residency in. So of course I mentioned the traditional community pharmacies, but it could be in a model where it's a medical home. It could be an employer work site where there's a pharmacy. I know there's a bunch of models like that. Specialty pharmacies are really growing in the number of residencies they have, and that's why we have some representatives here on this webinar related to that, and ambulatory care clinics. There's others you see listed there. I think I listed the main ones that we see residencies occurring in, and then there's a lot, really the settings are unlimited. So some really wonderful opportunities there. So the learning experiences that you'll experience during a community-based residency based on the accreditation standard, you're going to get some medication therapy management, which really now is really evolved from traditionally starting in the community setting, and really a lot of settings have it now. So you'll become an expert in reviewing a patient's medications, making sure you look for appropriateness and so on. You'll get some chronic disease state management experience, and that really varies. So if you're looking at programs, you'll want to ask them what are their focuses in the chronic disease state management. Do they have a lot of diabetic patients? Is it asthmatics? Is it anticoagulation and so on? So a lot of different opportunities out there. In specialty, there are some I'm blanking on, there's rheumatoid arthritis, there's oncology and so on, with specialty that you'll get some experiences in. Then of course you'll learn about wellness and prevention, immunizations and screening specifically. Not everyone actually gives the shots anymore, but as long as you learn what to do, how to assess and screen and so on, and promote immunization access. There can be acute care management for minor illnesses is really growing in the community sector, primary care wise. So doing swabs for various illnesses and getting the results and being able to furnish medications potentially based on collaborative practice agreements. Varies by state, so but there's a lot of opportunities there. And then transitions of care, helping a patient move from one setting to the other is a big part of a community pharmacist's work. So a lot of great patient care opportunities there for you. And then, of course, I've mentioned things like, well, practice advancement is your projects. So the projects are really helping do that research and creating models to advance patient care. You've got your leadership opportunities, teaching, education, and dissemination of knowledge is our precepting, giving presentations, and so on. And then, of course, the projects as well that I just mentioned. So a lot of great opportunities. There's a lot in 1 year, and that's why they often equate it to more than 1 year of experience. But you really take a lot from a residency program, and there's a lot that you can do after it. So what are the benefits of doing a residency in general, or specifically a community-based pharmacy residency? Really, one of the biggest things why this is the top of the pyramid is competitive job market advantage. So you really have been trained in multiple different areas through your residency. You've got experiences that have been refined from pharmacy school that can really set you up as an excellent candidate for a job after residency training. So one big thing, I feel like I said, I never thought I'd end up where I am. I never thought I'd end up in the career I did. And I really equate that starting from the residency, not just the credential, but the confidence and the skills that I was given during my residency training a long time ago now. You can have long-term career satisfaction. I think I just epitomized that I really have a great career satisfaction, and you could too. It's the long game. You may not get the job that you want right after residency, because it all really just depends on what's available and where you're able to go. It's almost like real estate. It's like you're looking at houses, what's available now when you need to buy, and are you specific to an area that you need to buy in, just like a workplace. Lots of networking opportunities with a residency. Most residency directors, preceptors are pulling their residents, say, okay, let me introduce you to this person, that person, not just in your organization, but residency directors and preceptors are often very involved in the profession, and they will spread the word and help you network. And networking can really also get you positions in the future. Networking has definitely benefited me throughout my career, not just in the job part, but all the other areas and parts of my career, volunteering and so on. Leadership development, you're still within 1 year of graduating, so people have different leadership qualities and skills, but you'll get exposed to it. You'll get benefit of being in front and communicating with other leaders in organizations, maybe being a part of a committee or work group, working together as a team as a part of leadership. So lots of different opportunities there. And then lastly, really rapid growth in personal, clinical, and leadership skills. I couldn't tell you the drastic difference in my residents when I had them in my program from when they started. Some were shy and timid, and then 12 months later, they're so confident and are shining in what they do. And I see that still in residents that I interact with when they are in the first 3 months of their residency training versus when they're towards the end. They've really grown in their confidence. So if you're a little shy, this could really help you grow in those communication skills. If you're already an outgoing person, you could grow even more. So some wonderful growth there with both your clinical and leadership skills. So these are all the potential opportunities we brainstormed about where we've seen PGY1 community-based residents go afterwards. So I'm not going to say every single one there, but these are all real positions that PGY1-based community residents have gotten after their residency program. So a lot of different PGY2 residencies. We focused in on that because not every residency, you're not going to go into a critical care PGY2 after a community-based residency. You haven't quite been given the foundational skills. It's not, you could, technically, it's allowed, but most likely a PGY2 critical care RPD wants someone that has more acute care experience. So these are the common PGY2s that we see community-based residents go into, but maybe you'll defy the odds and go into a different kind. And then, of course, you see a lot of different other positions there. So again, I won't read those because I want to get to our panel. So is it right for you? So these are questions, and we will make these slides available to everybody afterwards, that you should think about to decide, is community-based residency right for you? Do you like helping make an impact in a patient's life, and doing so through the best use of their medications and so on? So some great questions to really self-reflect on to decide what is the next stage in your career, because it is an investment of both your time and finances. Traditionally, community residents don't get paid as much as if you go straight into the workforce. So that's an investment as well. But again, thinking about the long-term career satisfaction that you could have there. So let's get into our resident perspectives. I'll ask Genwa and Emily to turn your cameras back on and get you all in the audience. If you haven't submitted your questions in the Q&A yet, please start doing so that we can be sure to answer your questions there. Um, I'm going to have the guest residents here, and I know one's not a resident anymore, but I'm going to group you together and say residents just to make it easier. Introduce themselves first. So let's just go in the order that I have you, and I did it alphabetically by last name so that it was fair. So again, what would you like to tell us about yourself?
Thank you, Nathan. Hi, everyone. My name is Genwa Hassan. I graduated from the Rutgers Ernest Mario School of Pharmacy back in May 2024. And I also graduated just this past June from the Northwestern Memorial Hospital PGY1 community-based residency within a specialty pharmacy. And I'm currently a PGY2 in ambulatory care at Northwestern Memorial Hospital. And I'm looking forward to answering all of your questions tonight. Thank you.
Thank you. We really appreciate you being here. And Emily.
Thank you so much. My name is Emily Shayota, and I graduated just a few months ago in May from the University of California, San Diego. And I am currently a PGY1 in the community residency program at Kaiser Permanente in San Diego, California. And I just started a couple months ago, so I am very happy to answer all of your questions, and it's very nice to meet all of you.
And Emily just got licensed as well, so congratulations to you on that also. That's a big
Thank
major
you.
milestone. You're welcome. All right. So as you're putting your questions in, I hope we're going to start with some questions to get everyone started that we think are probably general questions that you all might have. So we'll start and we'll go through and ask again one Emily to answer. What drew you to complete a community-based residency program? And I'll just have it whoever wants to jump in first. We'll keep it casual.
I can go ahead and start if that's okay.
Great.
So what drew me to this program? So I really realized I learned a lot about what I liked and what I didn't during my years in pharmacy school, especially during my fourth year in my rotations. And so as I was working and as I saw these different rotations, I realized I really loved the interactions with my patients that I have and the connections that I build with them. So a lot of the times with different rotations or different programs, you are maintaining the patient's care. However, sometimes you may not be able to directly speak to them or make that connection with them. So a community residency allows you to do that. And so I'm very passionate about patient care and also clinical decision making. So a community-based residency allows me to make clinical decisions and also build that connection with my patients so that they know that their care is in my hands and I care about them. And if they have any questions, they can direct it to me. And so that's why I chose a community-based program.
Thank you. And Genwa?
My answer is pretty similar to Emily's. I also learned a lot about what I was interested in and what I wasn't interested in during my appies, and it wasn't until towards the season of approaching mid-year where I decided that I did want to choose a community-based pharmacy residency program, and that's because I had completed my ambulatory care rotation. So I realized that I did really enjoy working outside of the hospital and in the clinic, and I didn't feel like working in the hospital was really what suited me. And like Emily said, I really do enjoy providing longitudinal care and following up with patients on a consistent basis, whether it be through follow-up or whether it be through just having a conversation with them, which was really limited in terms of inpatient care. So in overall, I just had a strong interest towards working outpatient. And I felt also this is almost like a side perk. I felt it really offered a lot more work-life balance in comparison to inpatient. So that's really what drew me towards choosing a community-based pharmacy residency program.
Great. Thank you. Excellent. I'm glad you brought up that you really just made up your mind right before mid-year. A lot of those of you on the webinar may be thinking, is it too late or when do I need to decide? And so it's definitely not too late. And that's one reason why we are holding these webinars early on in the fall so that you can think about it and decide. Mid-year is not a requirement to go to, but you do get a good opportunity to talk with a lot of potential programs, and maybe we'll come back around to that afterwards and ask again one Emily about their perspectives on how they prepared and learned about programs. But let's come back around to that because I want to keep going with these questions because it kind of flows. And we did have a question submitted that is similar to number 2 here. So what qualities did you look for in a program? And maybe as part of that, like specifically also what made you end up focusing and going into the residency that you chose, like specifically like, Genwa was specialty and Emily at the HMO setting. So why did you end up liking those types of settings to do a residency in that? But so focus on the general qualities as well as then why'd you pick those settings? Maybe let's start in the reverse order. Genwa, do you want to go first on this one?
Sure. So in terms of qualities I was looking for in a program, the number one was diversity and rotations. So Northwestern had a very strong program, even though it was brand new. So it was the first year of the program. And what drew me to them was their, again, diversity in the rotations, but they were also very unique, which is what drew me towards the specialty setting in the first place. So I had some really interesting rotations, and these are my core required ones. They're not even electives. That included women's reproductive health, that included neurology, that included rheumatology. So these were all areas that I hadn't had much experience with during my APPEs and are briefly covered in pharmacy school because they're not quote unquote traditional in terms of general pharmacist jobs that are available, at least on the East Coast. So I wanted to get that experience, and Northwestern, honestly, I'm not plugging Northwestern, but they offered all of these rotations, and I didn't even have to kind of make a plea to request these rotations. They're already ingrained. And then at the same time, I wanted a residency program that offered some sort of ambulatory care experience at the same time. So I was also able to take a primary care rotation within my program so that I can learn if I wanted to be just a specialty pharmacist or if I wanted to continue to pursue an ambulatory care PGY2, which I ended up doing. I did really enjoy that rotation, so I'm grateful for that experience. And then, of course, I think when you are looking at residency programs, one of the key things is that when you are interviewing with a program, that is really the greatest indicator for how well that program may serve you. So although a program may seem wonderful on paper, it really is up to the interview to decide if you mesh well with these people, if you feel like this is a good culture for you. And I think that's what I was really looking for in the program, if I could get along with the people that I was working with. And at the same time, it was a culture of like growth and fostering a resident and support. So that's ultimately what led me to my final ranking decision.
Thank you. Excellent. Emily, your perspective.
Yes, so I agree with everything that Genwa said, but I would say, in addition, the biggest quality that I really looked out for was a balance of opportunities that are offered throughout the residency. Because, like Nathan mentioned earlier, the residency is a voluntary additional year outside of your schooling. And so for me, you should make sure that everything that's going to happen in that year is going to serve you and your learning and your training, because this is benefiting you so that you can benefit your patients. And so where I'm at right now at Kaiser Permanente, I found that it served a perfect balance between community settings, so community pharmacy in addition to ambulatory care clinics. And so I'm able to have the experiences in community setting where I'm able to look at administration or looking what managers do behind the scenes, because if you don't do that and you don't see that, then you'll never know what happens behind the scenes. And so for me, I am interested in becoming a manager one day or a preceptor one day. So I really wanted to see that aspect of things to see if that's truly what I wanted and what I desired before I went into it. And also I have the side of ambulatory care. So I'm able to go into clinics that focus on diabetes, on kidney function, on all of these different things that is very pertinent to patient care. And so I really valued that balance of learning experiences and opportunities that I can gain as a resident during my training that I'm here for a year. So I would highly recommend that when you look for a residency program, find what is the best balance for you and what do you want to gain from it, so that when you are in this year, you're not just going there through the motions. You're doing it to benefit you and your patients. And that's what I would say about that.
Excellent. Thank you. Great perspectives from both of you. And please tout your programs. If you like your programs and that we know that the awareness will come about your programs. So please share. Don't hesitate. We think if they're excellent programs, tell everyone about it. Okay. We do have a couple other questions submitted. One, I'll go directly to this one, and well, they kind of tie in together. So, Emily, we had somebody. Oops, sorry. My computer just said something weird. Apologies for that little blurb. We had somebody that works at a Kaiser outpatient pharmacy that's on the webinar today. Oh, you know. So they're interested in the Kaiser program. So they asked, do you have any advice going into the application or interview? And then there's a similar question just in general, what makes you stand out as an applicant when applying to residency? So maybe we'll make it general, and then maybe there's a way that we can get you in touch with the person that also works at Kaiser. But whoever wants to answer again, just what makes you stand out compared to other applicants when applying to residency?
Yeah, so I actually worked as an outpatient intern during my schooling, so that's awesome. But so I feel like something that made me stand out was that every question that I got during my interviews, I not only answered the question, but I provided examples to it. So, for example, if one of the questions was, what are the top three qualities a resident should have? I gave the three qualities and I explained how I have those qualities. So, I feel like what makes anybody stand out is that instead of just answering the question and stopping there, you should give an example as to how you have shown it or what have you done for to back up that answer, because the more that you show examples, the more that it shows the people that are interviewing you that you actually want to be there, and so it'll put you at the top of their list for their candidates for sure.
Great advice. Any additional advice, Genwa?
I definitely agree with Emily. I think it's really important to play to your experience when you are in an interview, but being on the other side and interviewing residents this past year for our program for this class, I'll note that one piece of advice that I want to give is to, and it may sound corny, but it's just to be yourself. It's really easy to pick up when a candidate is not being genuine or is almost saying what the interviewer wants to hear, but we really want to get to know you because we'll be working with you for the next year and we want to make sure that you're someone we want to work with. So on top of being, professional and giving all of these examples, just don't make sure to, just be yourself, be genuine, and just be upfront.
Great example. Be authentic and yourself. That's what we want to see when we're interviewing others. So love to hear that advice as well. And I really recommend, I'll add on to that just from my perspective as a director and interviewing a lot of residents over the years, practice. So recommend if there's opportunities at your schools where they offer mock interviewing, take up on it. It can be nerve-wracking. You might be nervous, but that's the safest environment you're going to be in because they want to help you succeed. So if you can practice write out examples of answers to questions in regards to like common interview questions. So like one example would be that you get often asked about, like what's a time you worked on a team, and talk about maybe if there was conflict in that team and how did you work through it. Think of an example, write that out. You don't want to have the notes in front of you in the interview because that'll make it, like Genwa said, you won't seem sincere and authentic if you're reading off answers, but at least you've thought about it in advance. And that answer can also be applied to many different types of questions that get asked you. So you want to kind of create some real life scenarios of experiences you've had through school or different experiences and kind of think about what you would share about them, and then they can be applied to many different questions. So just a piece of advice with getting ready for interviews there. Okay, next question. We'll see if you all can answer this. If you've worked in multiple different types of settings, or maybe through your appies in school, well, the question is, what's it like working in a specialty pharmacy versus a traditional community pharmacy? Would you be able to answer that? Okay.
Of course. So specialty pharmacy is, I can't speak for all of them, but I will speak on behalf of my program. So although our program is within an outpatient specialty pharmacy, there was no retail component minus your staffing component was which was in operations. Throughout your rotations, although you are mainly in a specialty pharmacy on the outpatient side, you will be placed in clinic, where you will follow up with patients there. And then when you're also not in clinic, you will still, again, be outside of that retail setting and you're mainly responsible for patient counseling. So those referrals come in from our providers that reach the specialty pharmacy that's connected to Northwestern. And then we receive those referrals, we review them, we conduct essentially a medication review, and then we have telephone encounters with patients where we call them, we counsel them, we get their history, we conduct a med rec, we make sure that the medication is appropriate, we assess their labs. So it's essentially what you would be doing on on a patient in the ambulatory care setting or even inpatient. But again, there is no retail component, but I really cannot speak for other programs. This is really just what Northwestern did, which is also something that drew me to their program. I didn't want a almost retail-like residency that focused on dispensing. This is really, again, clinical work.
Thank you. Yeah, and there are specialty pharmacies in a lot of different types of settings. So there are some that are um, more heavy in your traditional community pharmacy, the retail, quote unquote, where there's dispensing of traditional scripts maybe during part of your residency and then focus on specialty meds during other parts, a lot of different models. So that's your opportunity to ask questions of the program or look at their websites and how they describe their program so you can kind of know what are the pieces and setting that you're working in. A lot of specialty pharmacies conducted telephonically, so there may be more telephone interaction than other community pharmacy settings as well. And then let's give the opportunity, Emily, since Gemma was able to kind of describe her practice setting at her residency, why don't you tell us a little bit about the practice setting at your residency program for the people on the webinar?
Yeah, no problem. So I did start 2 months ago, so I can talk about what I have done already and what's upcoming.
Great.
So for my residency, it is community and ambulatory care focused. So when I started, I had a 2 week introduction to community. And so, what it should be usually is in those 2 weeks, residents will learn about the Kaiser systems, how it's implemented, how to fill medications, and how to do all of that. But because I was an outpatient intern, I had already done all of that. And so, coming into those first 2 weeks, I was able to learn what management side looks like a little bit. So, for example, like how ordering controlled medications looks like, or how to look at patient reviews and contact the patients in terms of any types of concerns that they had. So any type of management or administration side, I was able to look at that for the first 2 weeks. After that, I had about a month in my complete care management rotation. And what that is essentially we are looking at a patient's chart and we're looking at their diabetes medications, their A1C, where their blood sugar targets are, and we're looking at how they trend. And so we'll give them a call and we'll say, so it looks like you're elevated here or you're going low here. Let's adjust your insulin dose or let's add this new medication. And so we'll communicate with them over the phone. We'll see what they're comfortable with because sometimes patients don't want to add medications or they don't want to change things because they have a routine. And so we just communicate with them, see what they're comfortable with, make the adjustments accordingly. And we also do look at, for example, their lipid levels. So if they're on like a cholesterol lowering medication or for their blood pressure management. So we do all of that. That's why it's called complete care, where we're able to look at those high disease states. And so after that month, for the rest of the year, I will be doing once a week in that rotation. So I will still be going back once a week until the end of the year. And I just started in my renal ambulatory care clinic rotation. And so renal, if we don't know already, is the kidney clinic. And so what I do is I look at patients with chronic kidney disease, and I'm able to look at their iron levels, their hemoglobin levels to see if they're anemic. If they are anemic, I'm then going to prescribe a medication, recommend the dose, recommend follow-ups, blood pressure checks, all of that stuff, make a plan, document it, and call the patient to let them know that this is the new plan, this is what they have to do. And then after this rotation, I'll be going into my anticoagulation clinic where I don't know the details about it too much, but essentially it should be the same thing where I just monitor patients' anticoagulation medications to see if, they need to be adjusted based on their kidney function or, if they're at risk of bleeding or clotting. I also have medication therapy management and transitions of care rotations. And at the very end, I will be doing home infusion. And so essentially, what everyone tells me is really exciting is that it's almost a mix of outpatient, inpatient, and ambulatory care. And so I'm really excited about that. So I get to see all of these different aspects of pharmacy just within the 1 year. So it's going to be fun.
Sounds like a great opportunity for you, and that you got into the right residency program for you. All
Yes.
right, I'm just going to put the slide back up with your titles so people remember your names and where you're from. Just realize we don't need those questions anymore. Okay, this next question is specific to Genwa about specialty pharmacy. You've mentioned different things in describing specialty pharmacy, but which high-cost medications or which disease states did you see the most during your residency? If there is one, or was it a broad view? So let us know.
So within my residency, there's really no disease state or medication we saw the most because we had the opportunity to rotate through all of them. You will rotate through, or we rotated through oncology, which has a wide series of specialty medications. It's focused on oral anti-cancer agents and oral chemotherapy, which is what I actually did my research on. And there's a ton of those. So there's no one that will stand out. And you probably by the end of the rotation can only remember a handful because there are so many. Within our rheumatology clinic, we have a lot of patients that were on Humira. That was our blockbuster drug. But we stopped servicing that medication, so we've been seeing a lot of biosimilars. Those are really huge within specialty pharmacy, especially for IBS, IBD, and also for the dermatology disease states. So you'll see a lot of psoriasis. It's one of our big ones, as well as eczema. You'll also see within this particular program our neuro team, which covers Huntington's disease, multiple sclerosis, and also our asthma team, which covers very severe eosinophilic asthma, along with other disease states that are less common. Within neuro-oncology, which is a branch of oncology, you'll see a lot of glioblastomas. That was my longitudinal clinic, which was very interesting. And then our fertility clinic is focused specifically on hormonal therapy for patients that are trying to conceive. So you'll get a really wide array of different experiences, and then you'll also get to experience all of these disease states and more. And then all of the medications that go along with them. So we service majority of the medications. So you'll see a lot of also non-specialty or specialty-like medications like the GLP-1s. We have a GLP-1 clinic and lifestyle medicine weight loss clinic, as well as our cardiology clinic, which services Repatha, Praluent, those almost specialty-like medications. So it's really a wide variety of different diseases and all of the medications that fall underneath the specialty category.
Excellent. Thank you for that. All right, turning back to residency specific assignments and so on, someone asks, what types of research projects or presentations did you complete during the residency? Did you present at any conferences or showcases? So if you'd like to share. You probably both did a lot, so just be brief. I give some examples.
I can start. So, in terms of what I've done in my residency so far, it's only been 2 months, so I haven't had the opportunity to present anywhere, any conference yet. But your research project gets going right away. And so my research project just focuses on pharmacogenomics. And so that is a growing field in Kaiser Permanente. And so currently, right now, pharmacogenomics is growing within our providers in our medical office buildings and also for our patients. But our pharmacists aren't aware that it's a thing, or they aren't able to answer questions that patients may have or providers may have. And so my research project is tailored towards providing all of our pharmacists across all of our service lines. So inpatient pharmacists, outpatient, home infusion, and ambulatory care. So about 300 pharmacists that we want to implement this program on. And we want to implement an education program so that they are aware that this is a growing field within Kaiser, and to be aware that patients and providers are utilizing pharmacogenomic testing. And so to get them the ability to answer any type of questions in terms of, utilizing labs or utilizing different medications that may benefit or harm people based on their genes. So we're implementing that program across our pharmacists, and it should be implemented very shortly. We are getting approval for it soon. So that's my project. And we do hope to publish it and present it at conferences in the future, but that may be in a few months.
Yes, I'm sure you've got to gather your data before you get to that point, but excellent. Thank you for that. That was very interesting. That should be a great project. And then Genwa, what research did you do and where did you present?
I did my research for last year on the analysis of hypertension in patients that are taking oral anti-cancer agents that are being serviced by the Northwestern Specialty Pharmacy. So the specialty pharmacy essentially services the entire Northwestern health system, which there's plenty of different branches. So we had a pretty long patient list that we wanted to assess. And then I essentially gathered the list of oral chemo agents that we serviced that had the highest incidence of hypertension, and then analyzed that data to find that approximately 60% of our patients had uncontrolled blood pressure within 1 month, 3 month, and 12 months of starting an oral anti-cancer agent, which is essentially going to be implemented as a quality improvement project to try to have a pharmacist monitor patients' hypertension once they are initiated on one of these agents, hopefully within the next year or so. And that was presented at the Vizient conference at mid-year last year. But in terms of other presentations, just to be brief, you'll have plenty during your residency. You'll have in-services, topic discussions, journal clubs, but most importantly, you'll also have a CE presentation that is required. I did mine on artificial intelligence in health system pharmacies, and also most likely patient cases, as well as sorry, it's slipping my mind, but the most important one will be the CE along with your research project.
Great, thank you. And the questions are rolling in, everyone's warmed up. So, and we're unfortunately getting towards the end of our time. So I'll preface that we might not be able to get to all the remaining questions. So I apologize, but we'll do our best. But I like this one that was recently asked, because it's a nice one to start to end the webinar on. What experiences should someone seek out as a student to help prepare them for residency? I think that's a great question.
So, something that I would say really benefited me was I truly learned what I liked and what I didn't during my 4th year of pharmacy school when I was on my rotations. And so what I did even throughout my 4th year, so during my first, second, third, and 4th year, I did work as an intern. And so I'm not saying everyone has to, but it benefited me so much because I not only got to learn directly how medications work, how to counsel, what medications and dosing looks like. Because to me, I learn more when I see things in front of me and when I do things. And so, yes, it does take time and it takes a lot of time management skills that you need to develop. But I would say working throughout pharmacy school really, really helped me and prepared me to understand what do I like, and also gave me those experiences, like, for example, discussing with physicians on different medication recommendations that I have, or, just simple things like that, where I wouldn't have been able to get that if I didn't work beforehand. And so I would say that was really beneficial to me. And also really, really take your rotations that you're on during pharmacy school seriously, because that is so important. Yes, you can go just to go for the hours and come home, but it's so important to actually learn and to understand and make those connections with your preceptors and coworkers, because, you know, potentially you could be working with them one day. You might fall in love with a specific area. You might realize this is somewhere I don't want to be. So really use every hour that you have to your advantage and just make the most of it while you really can.
Great advice. Thank you. Genwa, anything to add?
100% agree with taking your appies seriously. Residency is kind of like appies, but with a lot more accountability and a lot more work. So just, don't coast by. If it's something that you're interested in pursuing, just try to give it your all and learn as much as you can. And then in terms of preparing for residency, there's really not much to do besides taking Appy seriously, but I also always recommend to do as much volunteer work as you can outside of Appies. For example, I volunteered at a clinic where I was a student pharmacist working with student doctors. It was run through my school of pharmacy, so I got to have that experience on top of my appies, which really, really helped, and I think it really strengthened my resume. And then I also had conducted research during my P3 year, so I think it's really helpful if you have conducted research or are planning on conducting research during your P3 or P4 year before you start residency, because there is a lot of research required for residency. Even outside of your primary project, there's a lot of literature evaluations and research that you'll have to do, even for drug information questions. So just having those skills is something that's really helpful. And on top of what Emily said, I think it's great if you have experience working in a pharmacy or interning at a pharmacy on top of that.
Excellent. Also great advice. Thank you. Well, I think we need to start wrapping up to be respectful of everyone's time. I have a few housekeeping things just to close up with, but thank you again, Juan, Emily, for your perspectives and sharing all about your programs. And hopefully it did create some awareness about your programs, but in general about community-based residency and in the different settings that we offered here. If you're willing to put your email in the chat for people to contact you, but don't feel obligated, because there were a few more other questions and people might have specific questions for you. So if you're comfortable with that, do that. I'm going to put mine in there as well, because someone sent through a question for me specifically, and I just don't have the opportunity to answer that as part of this webinar. So I'm going to put mine up there too, npope@ashp.org, so that that person can feel free to send me an email and ask me. Anybody can. So thank you for being a part of our webinar. If you do have further questions about residency in general, please grab these links from these QR codes real quick. I'll leave them up there for a minute. We've got residency resources specific that ASHP offers, as well as a residency resources that APHA offers as well. But if you just Google APHA community residency, you Google ASHP community residency, you'll also find them. But grab those QR codes there, and then we will make these slides available, and we've got some other slides after this of different tips about, again, how to applying and other things that you should be aware of that we just thought, we're too far advanced for this webinar, as far as, we want you to create awareness for. But I could tell that a lot of you are already thinking about interviews and applying, and so now's the time to start exploring those resources. Okay, I think I left that up long enough. So I'll just pitch our next webinar coming up next month, October 16th at 7 p.m. Eastern, and then your respective time zones. That's where we're going to focus in on independent pharmacy and nationwide chain pharmacies. So we have a representative, just recent graduates from two programs, one from Kennesaw, Georgia, innovation compounding. So it's independent and compounding focused. So really unique environment I had the pleasure of visiting. And then Walgreens Specialty Pharmacy with the Medical College of Wisconsin Pharmacy School residency program. Emma from there will be joining. So different perspectives of different settings. I know it's specialty also, but it's different because it's in the Walgreens versus an academic medical center like Northwestern. So please join us for that if you have more interest in that. And then we'll love to hear from you. So thank you. We see the thank yous in the chats. We appreciate you being a part of it. And hopefully this piqued your interest in community-based residency. And please send us follow-up questions if you do so with those emails. And we're 1 minute till, so I'll say goodbye. Thank you, everybody. Have a great rest of your evening.